Hey there, and welcome. Today we're going to talk about something called amniocentesis. It's a pretty incredible prenatal test that can give us a super detailed sneak peek at a baby's health, way before they're even born. So let's jump in and figure out what it is and how it all works. So what can you learn from just a single drop of fluid? I mean, it sounds kind of like science fiction, right? But it's true. It turns out just a tiny bit of the fluid that cushions a baby in the womb can tell us a ton. Let's get into how that's even possible. Okay, so first things first, what exactly is amniocentesis? Let's break down the basics of this really common prenatal procedure. At its heart, amniocentesis is a test where doctors take a very small sample of the amniotic fluid. That's the watery stuff inside the sac that protects and cushions the baby for the whole 9 months. Okay, so you might be thinking it's just fluid, right? Like water? Well, not exactly. And this is the really cool part. This amniotic fluid is packed with live cells that have actually shed from the baby, plus important proteins. You can almost think of it like a floating biological blueprint, just full of genetic clues and health information that scientists can actually read in a lab. Which, of course, brings us to our next big question. Why would someone even get this test? I mean, it's definitely not routine for every single pregnancy, so let's look at the specific reasons it might be offered. Usually, an amnio is an option when there's a higher than average chance for certain conditions. This could be because of something in the family history, or maybe the mother's age, or if an earlier screening test or ultrasound flagged something that needs a closer look. Now, here's something that's super important to understand. This one single procedure can be done for two totally different reasons. On the one hand, it's a powerful tool for genetic testing. But on the other hand, it can also be used much later in a pregnancy to see if a baby's lungs are ready for the outside world, just in case an early delivery is needed. And the timing for these two things is completely different. For any genetic screening, it's typically done between 15 and 20 weeks. See, if you do it any earlier, the risk of complications actually goes up. But for checking on those lungs, it's way later, usually sometime between weeks 32 and 39. Right, so what actually happens during the test? I think knowing the step-by-step can make the whole idea a lot less intimidating. Let's walk through it. So what's it actually like? Well, first off, it's an outpatient thing, so you're not checking into the hospital or anything. They start with an ultrasound, to get a clear picture and see exactly where the baby is. Safety first, always. Then, after the area on the abdomen is cleaned, the doctor uses that ultrasound image as a live map to guide a really thin, hollow needle in and draw out a little bit of that amniotic fluid. And that's it. That tiny sample is what gets sent off to the lab for all the testing. Okay, and this is the question on everyone's mind, for sure. Is it safe? Let's take a really honest look at the potential risks here. The idea here is just to be informed, right? Not to be scared. Pretty much every medical procedure has some level of risk, and it's just really important to know what they are. Now, the source material mentions a few potential issues. There's a small risk of miscarriage, some leaking fluid, or even infection. And it's also worth noting that if the mother has an infection like HIV or hepatitis C, doctors might advise against the procedure to avoid any chance of passing it to the baby. And this is probably the most important thing to remember. Yes, there are risks, but they are small. The real key here is talking it all through with your doctor. That conversation is so important because it helps you weigh the pros and cons for you, for your pregnancy. It's also super important to be clear on what this test can't do. Amniocentesis is amazing for genetic issues, but it won't pick up on certain physical birth defects like a cleft palate or problems with the heart. That's usually what the detailed ultrasounds are for. Okay, so the test is done, the sample's been analyzed. What happens then? Let's talk about what the results actually look like and what they could mean. The whole experience is really different depending on why you had the test. If you're checking for lung maturity, you'll get answers in just a few hours, and it basically gives the green light for a safe early delivery if that's what's needed. But for genetic results, it takes a few days, and while the answers are very accurate, they can sometimes lead to what the source describes as hard decisions. And no matter what the results are, you're not left to figure it out on your own. A genetic doctor or your own provider will sit down with you and explain everything, and what it means for you and your baby. And really, that's what this all boils down to, isn't it? Information is powerful. I mean, tests like this give us an unbelievable window into a baby's health, and that knowledge can be really empowering. But it also makes you think. It raises this bigger, more profound question for all of us. How do we decide what we really need or even want to know?